Great, thanks. So again, my name is Jill Mullen. I'm a policy advisor at the Colorado Division of Insurance. So I'm here today to discuss Colorado's out-of-network surprise billing law, and then just provide some updates on changes to our law based on the Federal No Surprises Act. So next slide. Okay, so first, just some background on Colorado's surprise billing law. So out-of-network medical bills or surprise bills occur when a person is billed for services received from a provider or facility that is not in their carrier's network. The surprise bill is usually the difference between the total bill for the claim and what the patient's insurance carrier paid towards that claim. So Colorado passed out-of-network billing protections in 2019 with House Bill 19-1174. The bill became effective January 1 of 2020 and protects consumers with DOI-regulated plans in 3 situations: when receiving emergency care from an out-of-network provider, when receiving emergency care from an out-of-network facility, and then when receiving non-emergency care at an in-network facility from an out-of-network provider. The bill has a couple other provisions we will discuss in the upcoming slides, but as an overview, it establishes payment rates that carriers must pay out-of-network providers. It requires carriers, providers, and facilities to develop and provide disclosures to consumers about receiving care from an out-of-network provider or facility. It creates an arbitration process for carriers and providers to use to settle out-of-network billing disputes. And it also requires carriers to report to the division on the use of out-of-network providers and facilities and the impact on premium affordability. We've completed and released a report with the out-of-network data submitted for the 2020 calendar year. The 2021 data will be released in a report that comes out on July 1. During the presentation, I will be sharing some of the data from the 2020 report just to kind of show what we're seeing related to out-of-network claims. Next slide, please. Okay, so first I wanted to give more information on the payment rates that were established in 1174. I realize this slide can be a little wordy, but I did want to go through the payment methodologies because I know Civic will discuss more about the challenges of using claims data to determine some of these payment amounts. So we can kind of go through these. But also, I'll mention in all payment situations, regardless of how the payment works out between the carrier and the provider, the patient is only required to pay their in-network cost sharing requirement for those out-of-network services. So the framework for when for carriers, when a covered person uses an out-of-network provider, the reimbursement rate must be the greater of 110% of the carrier's median in-network rate for that service in the same geographic area, or the 60th percentile of the in-network rate for the same service in the same geographic area for the prior year based on claims data from the APCD. Civic might talk about this too, but the APCD rates are updated annually and posted on the DOI website as a reference. Or it can be a separate, negotiated independent reimbursement rate. There's a somewhat similar payment framework for when a covered person receives emergency care from an out-of-network facility. The reimbursement rate must be the greater of 105% of the carrier's median in-network rate for that service provided in a similar facility in the same geographic area, or the median in-network rate for the same service provided in a similar facility in the same geographic area for the prior year based on claims data from the APCD, or a separate negotiated reimbursement rate. The law also includes a separate reimbursement rate for emergency services received at an out-of-network facility operated by Denver Health. That is very specific to Denver Health, so I won't go into it today, but just wanted to mention that that is also in the law. So based on the data that we received from carriers regarding claims by out-of-network providers in 2020, across all carriers, the rate calculated based on 110% of a carrier's median in-network rate was the most commonly utilized payment methodology. But across all carriers, all three payment methods were utilized for out-of-network providers. For facility out-of-network claims, the rate calculated based on 105% of a carrier's median in-network rate was the most commonly utilized payment method. But again, across all carriers, all three payment methods were utilized. Next slide, please. Oh, okay. So I think I mentioned earlier that House Bill 191174 sets up an arbitration process to settle billing disputes between providers and carriers. The arbitration process does not involve the consumer. This is only to settle disputes between providers and carriers. So arbitration may be requested if a provider believes that a payment made was not sufficient given the complexity and circumstances of the service provided. The provider has 90 days after receipt of payment to initiate arbitration. Next steps in the arbitration process include the out-of-network provider may arrange an informal settlement teleconference to resolve the issue, but it's not required. We have noticed in most cases, we have seen attempts at an informal settlement from both parties. But if that doesn't work, once an arbiter is assigned, the parties have 30 days to submit their final offers. This is baseball style arbitration. The arbiter picks one of the two offers and the losing party pays the arbitration fees. For 2020, the division received 26 requests for arbitration. All requests were settled outside of the arbitration process. In 2021, the division received 570 arbitration requests. Of those requests, 280 went to arbitration. The decisions in those arbitrations were pretty evenly split in favor of the provider or carrier. I'll also note that Colorado is one of only a few states to pass surprise billing legislation that includes both a standard reimbursement methodology for carriers and a dispute resolution process for providers. One last thing I'll sort of mention related to 1174 is the data the division collected from carriers related to the impact of these balance billing protections on carrier networks and premiums. For the first year of data reporting, we had really limited information available regarding the impact on premiums. Several carriers reported that they were unable to draw any conclusions regarding premium impacts with only 1 year of data. Carriers also submitted information on the impact of 1174 or the impact 1174 had on networks. Most carriers reported no change in their networks. 2 carriers actually reported an overall increase in their networks in 2020, including an increase in contracting interest from certain practice groups. So the division will really work on refining this data and will hopefully have more to share in the future related to the impacts on premiums and carrier networks. Okay, that's everything on 1174. So I was now going to discuss how this sort of ties in with the Federal No Surprises Act. Looks like we're already on slide 5. Great. So in December of 2020, Congress passed the Federal No Surprises Act. The federal law became effective on January 1 of 2022, and this protects consumers from surprise medical bills when receiving emergency care at an out-of-network facility or from an out-of-network provider, when receiving emergency air ambulance transportation, but not ground ambulance services. And then finally, when receiving elective non-emergency care at an in-network facility, but treatment is done by an out-of-network provider. So actually pretty similar to what we had in Colorado, except Colorado didn't touch air ambulance transportation. The NSA really expands surprise billing protections, particularly because those protections now apply to self-funded plans. Another interesting aspect of the NSA is states can impose requirements on providers and facilities that are actually more protective for consumers, but the NSA really needs to serve as a floor of consumer protection. In terms of enforcement of the NSA, states will continue to be the primary enforcers with backup enforcement by the federal government if a state fails to substantially enforce the law. The Federal Department of Labor will continue to regulate self-funded plans. According to the Commonwealth Fund, about 18 states have passed comprehensive laws prohibiting out-of-network billing, and there's another 15 that have more limited protections. So there are likely several states that are looking into how to align with the NSA right now. Colorado being one of those states, soon after the NSA passed, the division realized we would have to make changes to our state law to address inconsistencies between the federal and state law, but also to maintain some of the strong consumer protections in the NSA and ensure the division could enforce those protections against insurers. Next slide, please. Okay, so that brings us to House Bill 22-1284. This bill was introduced in the Colorado legislature in February. The division is working with the majority leader in the Colorado House, Rep. Escar, and Rep. Catlin. I'll highlight a couple of key areas where we wanted to ensure alignment with the NSA, and all of these are included in 1284. So first, we're adding balanced billing protections for post-stabilization services. So this protection will ensure that patients are protected from surprise bills until they can consent to be safely transferred to an in-network facility after receiving emergency services. So protections for post-stabilization care were not included in Colorado's original balanced billing law. So we really wanted to adopt those additional protections from the NSA. We're also aligning with the NSA disclosure requirements for providers, facilities, and carriers. I mentioned earlier that 1174 included disclosure requirements for patients being treated by an out-of-network provider, but we sought to avoid providers and facilities from sending two notices to consumers, one to comply with the state law and one to comply with the federal law, as that only really creates more consumer confusion. And for the most part, the disclosures were really similar. So in 1284, we adopt the disclosure requirements in the NSA. We're also aligning with the NSA's notice and consent timelines. The NSA requires a provider or facility to provide written notice that the provider is out of network at least 72 hours in advance of the scheduled service, or at least 3 hours in advance if the appointment is made within less than 72 hours. It also has a requirement, the notice must include a good faith estimate of the amount of charges the person may be responsible for if they choose to use the out-of-network provider. And if the person is at an in-network facility, they have to provide a list of participating providers at the facility who can provide the same services, but would be in-network. So this is, Colorado law didn't really specify timelines for notice and consent, and it didn't really require this upfront estimate of costs. So both are protections that we really wanted to add to our statute. We're also aligning with the NSA and creating an exception to the notice and consent requirements for certain ancillary services. So this prohibits certain provider types from ever balance billing a patient regardless of consent. The list of these providers primarily includes provider types that patients have no control over receiving services from, like anesthesiologists, assistant surgeons, radiologists. So Colorado's law didn't actually prohibit provider types from ever balance billing. So again, we wanted to align with the NSA on that because it was more consumer protective. And then finally, we are updating statute to allow for a 90-day period of continued coverage at in-network cost sharing for transitional care. This will require carriers to continue to cover an individual's care at the in-network rate for 90 days under certain circumstances. Colorado law currently only allows for 60 days of continued care, so we expanded that time frame. So the main goal of this bill is really alignment and to alleviate the potential for confusion for all entities, with the NSA and our current state law, being effective at the same time. And I do think that we have struck a good balance with this legislation. Next slide, please. So next steps. House Bill 22-1284 is still moving through the legislature. The bill passed out of the House Health and Insurance Committee last week, and it actually passed out of House Appropriations Committee this morning. Both committees, it passed unanimously. We expect it to be heard on the House floor sometime soon. And we've really been working with all interested parties to ensure agreement and alignment on this bill. Other next steps include changes needed based on upcoming federal rulemaking. We are anticipating rules on the good faith estimate. We specifically included language in 1284 stating that the requirement around providing a good faith estimate will not be implemented until federal rules are implemented. So the division will need to issue rules or potentially update existing rules based on those federal rules as they come out. And finally, we're really reviewing our own existing rules to determine what we may need to update to align with the federal NSA. Next slide, please.